Hello, everyone. I'm Patrick Butler, Vice President of Content and About, especially if you're a journalist who hasn't had a lot of experience covering health issues before. As you know, this is part of our online forum called the Global Health Reporting Forum, which we run on Facebook, and we're up to about 2,100 members from around the world now who are sharing information on that forum, sharing resources, starting collaborative reporting projects, and of course these webinars, which I believe this is the 10th one that we've done so far, are a part of that forum. We also have a lot of resources available on our IJNet website, ijnet.org. So we encourage you to check out those resources, which are in 7 languages, and in addition to the forum. So what we wanted to talk about today is, first of all, I want to introduce our guest, Thomas Abraham. He is a veteran journalist and foreign correspondent, author of 21st Century Plague, The Story of SARS, and most recently, Polio, the Odyssey of Eradication. He is an adjunct associate professor at the Journalism and Media Studies Center at the University of Hong Kong. He has been a consultant for the World Health Organization and worked at the WHO headquarters in Geneva during the influenza pandemic. Welcome, Professor Abraham.
Thank you for having me.
Great. Well, as we've noted before on our forum, virtually every journalist in the world now is a health journalist. We all have to cover this pandemic, even if we were covering sports or crime or entertainment before. But the vast majority of journalists who are covering this pandemic probably don't have a lot of experience on the health beat. So we want to find out, if you're covering this for the first time, how can you quickly get up to speed covering a very complex and very fast changing crisis? So Professor Abraham really is the perfect person to help us figure that out with a lot of experience covering global health crises in the past. So I'm going to start with a question, and I also want to encourage all of you who are listening to this webinar to post your questions in the Zoom chat or on Facebook Live if you're watching there. And my colleagues will pass me your questions so we can get them to Professor Abraham. I want to start out with asking you a little bit about how you assess the coverage that you've seen around the world. What are some of the best examples you've seen of coverage, and what are some of the things that you think journalists could be doing better?
Well, Patrick, it's really hard to judge because, people have been thrown into this, and this is probably one of the biggest stories that many people are going to be reporting during their entire careers, because when we finally come out of it, I think we're going to see that this is an event that is unprecedented, and this is one of the rare times when the word unprecedented is not over the top, right? And I think it's also something that will probably profoundly change the world in ways that we're still trying to figure out, right? So it's hard to judge. Everybody is really going full out. They're sort of, I think most people are overwhelmed. Reporting on this enormous story, very fast, a quick changing story, as you yourself mentioned. So I know one thing, that people will feel overwhelmed, people are feeling overwhelmed. And so one of the things I'd like to say is that, when events seem overwhelming, it's useful sometimes because we're flooded with information. That's the other thing as well, to step back a little bit and ask ourselves, hey, what is the story really about, right? And this is a story that has 3 basic elements, right? 3 actors, if you will, or 3, it's a 3-part play, if you will. Actor number 1, of course, is a virus. This new virus that emerged in China and is now crossing the world at this incredible speed, right? So part of the story is, what do we know about this virus? Is it changing, right? What are scientists able to tell us about this virus, its insides? Because these have implications for things like developing vaccines. Is it changing as it's going to passing through different populations? So that's one thing it's worth keeping. That's one sort of area, one pillar, if you will, of the story. The other pillar, of course, is what happens when the virus gets into a human being, right? How does it replicate? What does it do to people? How does the human body fight back? And that is the so-called, I guess, the clinical thing. How does the virus transmit, right? It infects me, it jumps, how does it go to somebody else? How quickly does it? So that's the second pillar, right? And the third pillar is, how are people responding to this, right? How are societies responding to this? How are individuals responding to this? How are scientists responding to this? How are governments responding to this? And I think if we step back and say, this is really what the story is, and my story is probably in one of these three slots. And also, if I get a story that's in one of these slots, can I link it to some of the other slots? For example, I read somewhere, there's this new paper that, science says that the virus has changed in some subtle way. So first, what is this way? And if it has changed, what does it mean for the other two pillars in terms of what it does for human beings, in terms of how people are supposed to respond to this? So I think this is, for somebody who hasn't done, even for people who have done this, if I were reporting this, I'd be completely overwhelmed. I think it's really, really important to step back and ask yourself frequently, what is this all about? What is the big picture? So that is sort of my perhaps slightly wordy response to your question.
It's very reassuring to hear you say that even you would be having a difficult time covering this. So thank you for that. Are there any kinds of stories that you think we should be doing more of? Maybe, we're covering a lot of the day-to-day, the case counts, the death counts. What do you think we should be doing more?
I think ultimately, behind each figure, behind each case count, basically the human beings. That doesn't mean that we report on each person who's fallen ill. That's not necessary. But what I'm saying is, what is the impact of, what does this all mean? What does it mean, for example, for doctors and nurses, right? What does it mean for hospital staff? What does it mean for people who are affected? What does it mean for people who cannot get out and work? A lot of us are fortunate enough to be able to work out of home, right? But if you are, you depend on a daily wage and you work in an industry where you need to get out there and do something, right? Mm-hmm. Maybe you're waiting at tables, maybe whatever it is, maybe you're laying roads, whatever it is. What does it mean for people like that? So I think these are some of the issues that we need to really go into. We need to start humanizing it, because the figures themselves are, so we need, in a sense, to attach meaning to figures, right? Figures are abstract. We are not abstract. The people who consume our work are not abstract. So we really need to make that bridge, if you will, and try and keep asking ourselves, what does this all mean? Because this is the one question that people are asking. What does this all mean?
Yeah.
The public, all of us are overwhelmed. It's not just journalists. The public also is trying to make sense of all of this. So I think, we'll keep doing, journalists will keep doing the stories they're doing, but I think it's more the context. You need to keep thinking, what does this mean? What does this mean? What does this mean, right? What does this really mean? And the other thing is, what is all of this leading to, right?
Okay.
When is this going to end? Do we have any idea when that's going to happen?
What are there any resources if somebody is trying to get up to speed on health issues in general and this crisis in particular? Where would you suggest they go? How should they build up their knowledge base so that they can report intelligently?
This is really, it's really hard. And even though I've been doing it, I keep learning new things all the time. And I do, like many people, I have no science background, and everybody actually did this until SARS came along. And I can tell you about where I learned, some of my own experiences, right? I was living in Hong Kong at that time, and I was very fortunate in having access to top flight scientists who were actually working on the virus and were willing to give me time. So basically talking to people, trying to understand what they do. I had a whole series of really basic microbiology textbooks as well, because I wasn't at that point even quite sure the difference between virus and bacteria. And you really need to know these things. Otherwise, a lot of what people are telling you makes very little sense. In terms of technical resources, I find the WHO website, that is www.who.int, is very good. It's got a lot of background material. The daily press conferences that the WHO Director General and his team address, that's open to people all over the world. So even if you're in your own country reporting what's happening there, it's useful to have this global picture. And you can also ask questions there, right? I think that's really useful. The third useful thing really is to link up with other people working on this, you know, people who've had more experience. Twitter is a great resource. And of course, the kinds of networks that you guys are putting together. So it's journalists helping each other, scientists and journalists helping each other. And also, since this is a global thing, looking across your own borders, what are other people writing? What are the WHO saying? Let me listen in on their press conference. If there's a CDC press conference and I'm not in the United States, maybe I want to listen into that just to see what they're doing. And the more you do, even if you may not use it immediately for a story, the more you listen, the more you learn. The more you speak to people, the more you learn. And this is how experience really is the best teacher, right? And this is, it's not hard because, you know, there are only so many days, and plus you need to do your own work. But this is something that we're going to have to learn really to, you know, to learn as we go, right? When I worked briefly at the WHO, one of my bosses, David Heyman, he described the SARS experience as building a boat and learning to sail it at the same time. And in a sense, that is what all of us are doing, right?
Mm-hmm. Right.
And we need to learn to sail it at the same time. It's not easy, but it can be done.
Did you learn anything from your experience reporting on SARS that might be helpful for people to know as they're reporting on this?
A lot of things. Part of it is what I told you earlier. It was this huge, huge learning process. The other thing is, I think it's important to understand that the way that countries and the world is responding to this new virus, the template, the roadmap, if you will, was laid during SARS, right? So everything that we are seeing now, in everything from travel restrictions to the kind of medical advice, clinical advice, all of that is really based on what happened during SARS, partly because this is a very similar virus, but more important, it set the template for how nations and people exchange information during SARS. The other thing that I found really useful during SARS is really understanding, and this is something that everybody who's reporting on this would see immediately, is seeing for the first time the impact that a microbe can have as it moves its way through society. And I was living in Hong Kong at that time, and to see a city like Hong Kong shut down by, you know, by this little speck of RNA, this genetic material, was something. And that is something that we are experiencing, you know, throughout. So it's really useful, I think, to go back and look at some of the stuff that was written during SARS by journalists, by people who've written books about it, and try and, because the same thing is going to be played out now. The one difference, of course, was that SARS was a very unusual virus. It disappeared after 6 to 7 months.
Mm-hmm.
You know, it disappeared by the June or July of 2003, and it has never been seen again in the world. Mm-hmm. I don't think that's going to happen with this. It's never, I mean, something like you know, a pathogen just disappearing has never been experienced before. And this one, this new version is showing that obviously it transmits a lot better, it's much more resilient, and it's going to be around for a lot longer.
Yeah. Sadly. You mentioned being in Hong Kong during SARS. You're teaching in Hong Kong, although you are in India right now. But did you have any thoughts on you know, as it was breaking out in China, the way the media was covering it within China, but also from outside the country? You know, we've seen some people calling it the Chinese virus. We've seen some really lashing out at people of Chinese descent in countries around the world as if it's their fault. Do you think that there's anything in terms of the coverage from outside China that could have been done better?
I think, I don't think it's the coverage itself, I think was fine. It's the way people, human beings, respond to this news, right? The same thing happened during SARS, and there was discrimination against Chinese people. Chinatowns in Vancouver and Toronto were deserted, and even in the United States as well, there was a general thing, let's not go and eat Chinese food. All of that was going on. I don't know whether you remember it, that was happening. You see the same thing here again, right? And so, when things like this happen, it's not the news media in a sense that's feeding this. And we view these things through the prisms of our own belief, our own value system. And so in a sense, the public, whatever information it gets, hey, this is a Chinese virus, right? These guys are up to something. They must have made it up in the lab. This is part of China's thrust for world domination, et cetera, et cetera. Having said which, the 2009 so-called swine flu pandemic, that arose in North America, right? It emerged in Mexico, but, sort of ancestors of this virus were found in farms across the Midwest, in pig farms, right? It never was called the North American virus. People did call it swine flu, and I know a lot of a lot of people in the pork industry, or those who did hog farmers and so on, were really upset. They don't call it swine flu,
right?
And so a huge effort was made, I think by the WHO and globally, not to call it swine flu, but to call it H1N1 2009, which nobody, of course, called it. So I think there is, sadly, a slight difference in the way the world, the great public, responds to diseases depending on where they come from. Now, clearly, people in China would not see this as, well, they may see this as a Chinese bug, but because it started in Wuhan, but they won't have the same thing saying, hey, this has happened, let's deal with it. In the same way, people in North America and in Mexico don't see H1N1 as a particularly Chinese problem. And the thing is, these are global issues. It's much more, these are globalized, diseases can arise anywhere, right? And when they do arise, it's the whole world that must get together and sort of tackle this, because at the end of the day, human beings are human beings. We're all vulnerable to these things. If one of these bugs gets into us, it does the same thing that it would do in a Chinese person, an African person, an Asian person, or a Caucasian. So, this is a fact of life, and I think it's really important. I think journalists obviously see this instinctively. Professionals don't go into it. I think the issue is that the public, people, or even probably maybe even journalists, when we don't wear our journalist hat, sort of revert to type, if you will. And all of us have our own values, our own prejudices, whether we like it or not, it's there. And these tend to come when, you read certain news and then you start tweeting things, or you put stuff on your Facebook page, hey, what did I tell you? And so on and so forth. So yes, it is unfortunate, but I wouldn't blame professional journalists for this. And we cannot control what people do with the information that's out there either. So maybe in a sense, this is a little bit out of, out of our scope, or, more than what journalists can do, really. It's a wider
Do we have a role in combating the spread of misinformation and disinformation? I'm thinking of everything from, you mentioned conspiracy theories about how it started, lots of stories spreading around about how to treat it with, that make no sense whatsoever, are not scientifically backed. What is our role in combating?
I think we have a very, very important role in both in combating misinformation, as well as sort of correcting things that are false. No, but here's the thing, so a lot of misinformation or conspiracy theories, they don't circulate that much through what we would describe as the mainstream media. They circulate on what we describe, I guess, as social media. So the question we need to ask ourselves is, how much do we plunge into this other world? Because both worlds, in a sense, feed off each other. And you could argue, hey, we shouldn't do anything, we're not reporting this. But I don't think that's right. I think we have, because ultimately we need to serve the public in whatever way we can. And if there's wrong information out there that the public is consuming, and when we talk about wrong information, this could be information that is positively harmful for you. I think all of us do have a responsibility to do whatever little we can do. And I don't say perhaps we may not have that great an impact. I don't know. But whatever little we can do, I think we are really duty bound to do that in terms of combating these things, in terms of sort of putting out stories saying this is just not true, right? And perhaps also trying to trace, and this is really interesting, how do these things start? Who starts these things? How do they sort of wend their way? And I don't know the answer. I'm fascinated by this. I mean, is there a factory of people sort of churning out this stuff? How do these things start? That itself, I think, is a fascinating story.
Yeah.
And these are all things that we can do, I think, when, and those who have time to breathe, and when people do get time to breathe a little bit, these are all things that I think should be looking into.
Luckily, there are people who are studying where these things come from, like First Draft and
exactly.
DFR Labs and many other people like that look into, really exploring where does this stuff come from, which is pretty important to understand where it's coming from if you're trying to at it. Who are the people who tend to believe and spread this information? Some of it is inadvertent, and some of it is intentional. I want to ask you a couple of questions now that have come in from our audience. Some of these were in advance of the workshop, and I'm seeing some questions coming in live as well. But let's start with a question from, I believe it's Bermet Talent from Ukraine, asked, how can we do human-focused, engaging stories when you can't be on the ground and most interviews have to be done online? You mentioned this earlier, the human story.
Yeah, I think that's a really, really important thing, because all said and done, we've had stories of journalists falling ill. We've had stories of journalists dying. And I've read stories of young, healthy people sort of, getting sick with COVID and dying. So we really need to look after ourselves. I think the great thing now is, the same way that Patrick, I'm talking to you, right? We do have the technologies that make it possible to talk to doctors on the front line, to talk to people, and not just talk to them, but see them. So this is actually much better than, doing things over phone. And you're talking to a doctor saying, I'm overwhelmed, just look at my office, I don't have any personal equipment here. And, with cameras and with a phone, you can actually do a lot. So I think rule number one is, I think all journalists have a duty, first of all, both to yourselves, your news organizations, your loved ones, whoever it is, not to put yourself, and this is a dangerous virus. For a lot of people, it's mild, but you never know. So I think one really has to take it. And I think all we can do in circumstances like this is to use all the array of wonderful technologies that are available and which were not available in 2003.
That's true.
In 2003, text messaging was state of the art, right? We couldn't do half the stuff that people are doing right now. So my answer to our colleague in the Ukraine is basically we just have to stay safe, and number two, use technology to the extent possible. And at the end of the day, there's only so much you can do, and sort of do our best with this.
Interviewing doctors and experts via, the kind of chat we're doing now is a good thing, but also to tell the story from this perspective of those who are getting it, the hospitals, the doctors, the nurses, other medical personnel. If we can't get into hospitals, is that somehow not giving a full picture of what is going on? I know, for example, we're seeing some people in the United States who don't believe that this is a real threat, saying, well, I don't see anything happening. I don't see, but we can't be in the hospitals for the most part. Is that a problem that we're not showing the real cost?
I think, if you cannot be, I think we can get over that just by talking to nurses, stressed out people, and, asking them maybe to walk around the hospital with their phones and to tell people, this is what's going on. So I think we can get over that. In terms of talking to sufferers, we've had a lot of stories saying I had SARS and it was terrible. This is what I felt like. I'm a lot better now. These are my symptoms. And those are useful. And so if somebody wants to talk to you about this, that's fine. It really depends on whether that person is comfortable to talk about their experiences. once more you get access to them, perhaps their family members. It really depends on, whether the patient or the person giving you information is happy to do this. And so, yes, it's not the easiest thing, but I also like to, if there's a full-blown epidemic going on, at the best of times, doctors don't want journalists tramping through hospital corridors and sort of clogging up outpatient departments and, shoving microphones, because it harms their work as well. And ultimately, if you're not letting a doctor do their work, then that defeats the entire purpose of what you're doing. So in a sense, I don't think that's such a big deal. And I think we can find ways to work around this.
Great. Another question from Wendy Bone on the about investigative journalism. How can journalists learn more about how those in power are profiting from the pandemic in developing countries where governments can be even more opaque and authoritarian than in developed countries? She says she's struggling with this and would appreciate your advice. So looking into where the money's going is another important
Absolutely. And I think this is going to be a big story because of the amounts of money that are being spent on, on equipment, on personal equipment, and so on and so forth. So whether it's a developing country, whether it's a developed country, this is a huge thing. Most places, at least if you can get some idea of who the vendors are, right? Who is supplying? I mean, a tender perhaps goes out for 100,000 pieces of, gloves of some kind, or I think it's finding out who's actually supplying this is not that difficult. If it's somebody overseas, I would strongly recommend also building up networks, and the sort of work that all of you are doing and so on is really helpful. It's hard to work on this on your own. And as we've seen, every big investigative story really has been a multi-part, lots of people in lots of places involved, because at the end of the day, these are global stories, because these are global supply chains. Right? Yeah. So it's and I think it's really, it's not easy. It's not easy at the best of times. It's not easy, particularly when you're in the midst of another crisis. But I think over time, things will come out, maybe not in real time. But I think it's really important for people to build up networks, right? So we know, for example, China is a major supplier of pharmaceutical equipment, of protective equipment as well, face masks. So we probably need colleagues in China today. Who are the big companies that are supplying this, right? And how can I find out, who is supplying country A, B, C, or D? And so I think if we work in teams, we can do this, but it's not going to be quick. And to be honest, I think it's probably after the disease part of it dies down that people probably would have more attention, time, and resources really to focus on, this would be part of the aftermath of the pandemic, of this phase of the pandemic. But I think networks are really essential.
Great. Another question from Hamad Sarfraz in Pakistan. And he asks, many reporters are now covering COVID-19, which may not be their beat, as we said earlier. Do you have any special tips on the use of language when covering the pandemic?
Yes, many tips. Hamad, here's the thing. Part of the thing is that public health experts, the language of science it's written in English, right? You feel you understand it, but words have very, very different meanings, right? So things like infected and infectious are two actually different, a person could be infected without being infectious and vice versa. And all of these have very particular meanings. Asymptomatic versus pre-symptomatic, quarantine versus isolation. So the problem is real, it's huge. And once more, I think a really good start would be to try and talk to a doctor, make buddies, maybe somebody you were in high school with went on to become a doctor. And it's people like that you can sit down with and say, please explain these things. You can read up as well. There are a lot of good guides online. I don't have links at the moment, but I'm happy to pass them on. But I think things like this is where you need a shepherd, right?
Hmm. Hmm.
A guru, a shepherd,
Yes.
somebody who would take you through the basics. And I think this is where having good contacts help, because you need somebody who you can call also saying, hey, what do these words mean? A text, who can go have a cup of coffee with, spend half an hour with, and saying, I don't understand it. Could you explain some of this? So ideally, you should have something like that, or some person like that, or a group of people like that. Very often, this could be other journalist support networks. So that you can throw a question out, hey, does anybody know what this means? The big thing, of course, is not to be sure yourself that you know what something means. Is to be always, unless you have a doubt yourself, you're not going to ask anybody. And I
Hmm.
think a really good thing is, okay, this is probably what infectious means. And I think the thing to be always have this sort of nagging little voice at the back of your mind saying this is what it means in plain English, but it may not be the way that, public health people are. So let me just check.
Okay.
And so, which is a
Even
really, yeah,
Go ahead.
go ahead.
Well, I was going to say, even the terms COVID-19 versus coronavirus, which many people use interchangeably, but
Yeah,
they're not exactly the same thing.
no. So one is the virus that causes illness, and the other is the name of the disease.
Right.
And
Okay.
the name of the virus actually is SARS coronavirus 2, right? So a bit like Godfather 2. And
One rarely sees it called that, though.
it is,
Yeah,
yes. That is the name of the bug,
right.
if you
That's the official name. Okay.
will.
Some other questions that are now coming in live. One question from Jared Reed at Deutsche Welle in Berlin. And he asks, what do you think are the lessons so far from the pandemic that could affect how we report on issues and crises like climate change? So this is obviously related to environment.
Yeah, I think that's a really, really important, because at the end of the day, this is going to be the biggest, I've said this before, I'll say it again. This is going to be one of the biggest stories that many people, I think, are going to be reporting on their entire career. I don't think anything this big is going to happen. And part of the reason is because it tells us so much about the globalized world that we live in, and also about the sort of imbalances. I mean, I strongly believe in a sort of ecological point of view, and my biases are no doubt clear, sort of coming through here, and I'm happy with my biases. Really, these are disturbances in the relationship between man and animals, between man and the environment, between, all these other factors that make it easier for new diseases to emerge, right? And as global climate patterns also change, we're already seeing diseases, mosquito-borne diseases like malaria and chikungunya, dengue turning up in Italy, which they haven't for 150 years, since they cleared the malarial marshes outside Rome and so on. And why is that? Because once more, well, globalization, so these mosquitoes are coming in, and also because the climate is getting warmer and so on and so forth. So I think this is really a story about where the world is today, the kind of world that we live in today. So I'm sorry, this is probably a really long, slightly rambling answer to the question, but I think all of these things tie in, and in a sense, everything is about everything else. Patrick, I have a quick question. It's getting darker around me. Should I put a light on, or am I okay?
Yeah, it is true. You are getting a little dark. If you can put a light on, that would be great, but not absolutely essential.
Okay, so let me keep going a little more, right?
All right, great. Yeah. So another question coming from our audience is about what kinds of exemplary, are you seeing any exemplary stories around or news media in the way they're covering this? Anyone that you
Yeah, I think there are a lot of really, really good stories coming from, I mean, obviously stuff that the New York Times does, the specialized news agencies like Stat News, the stuff that they do, stories that are coming out of India now, really looking at data, because the daily press conferences that the Indian government has been holding have been less than forthcoming. So people now are going and looking at the data itself, and trying to make sense of the figures that are coming out. So I think journalists across the world are really, in a sense, rising to this. I mean, I don't have any sort of examples to show up saying, hey people, this is a great story, because there's 1,000 other stories that probably would be equally good. But there is good journalism coming out. And I think the standard of journalism, here's one thing I can say. The kind of reporting that happened during the first SARS was nowhere near at this level. And why is that? Because journalists also didn't know what this was about. This was a first for everybody. And those who had reported on the first SARS or first became aware of infectious diseases, emerging infectious diseases, and so on during the first SARS are that much better prepared. And so everybody who's reporting this is going to be absolutely super when, either the next wave of the same disease comes back, or when something similar happens in the future.
Another question, you mentioned being in India, and India is one of the examples we're seeing where the government is, using this crisis as a way of controlling the information. In the case of India, news media have to publish the official Indian line on what is going on, although it doesn't say, the law does not say that they can't do additional reporting. But are you concerned about countries using this to restrict media and journalists, and whether those restrictions will remain even after the crisis?
I'm very concerned. One of the big criticisms of China has been the fact that a doctor who knew about this was stopped from, putting stuff out, and then, and everybody was outraged, right? And this was a sort of, and everybody could see this was a bad thing to do. But now other governments who probably were outraged at the Chinese cover-up are doing exactly the same thing. Not every government, and this is appalling. And let me tell you why this is appalling. It is appalling because at the end of the day, misinformation actually, or suppressing information, and this is one huge lesson that we learned from the original SARS. Suppressing information actually leads to the loss of lives. And for anyone who's not familiar, let me just go back to what happened during the first SARS. This was a disease that broke out in November 2002 in Guangdong province in southern China. November, December, January. People were dying, doctors were up to their neck trying to teach this, but the provincial government refused to allow news organizations to report on this. The official news agency, Xinhua, was allowed to, publish sort of official releases and so on. And because of that, the disease, lives were lost in China, and lives were lost globally as well, because each country, when it came to Hong Kong, people had to relearn stuff that doctors in China already knew, and lives were lost during that period. So to cut a long story short, covering up actually it's not more just a moral, imperative in terms of freedom of expression. It has a real effect in terms of lives that are lost.
We are having a very hard time seeing you now. So
okay, I figured.
Chance to set on a light.
Okay,
while you're doing that, I can.
All of you. Actually, I'm wearing a pair of shorts under my shirt. So
that's all right. We all are. Everybody knows that no one's looking at the lower halves of our body. While he's doing that, I'll just kind of remind everyone that we will be making a recording of this webinar available both on the forum, the Facebook forum, and on ICFJ's website, icfj.org. And of course, I'll remind you again that you can get lots and lots of resources in 7 languages about the pandemic and how to cover it better at our ijnet.org website. Okay, back to you, Professor Abraham. And I have another question from the audience. This one is from Thomas Mwiraria, I'm sure I'm pronouncing that wrong, who's a freelance journalist in Kenya. And he's asking more about disinformation. He wants to know, how much traffic should a piece of mis or disinformation have before we address it? What is the breaking point, and how can we determine that?
Sure, it's an interesting question. I mean, because very often when we see crazy stuff on Facebook, we say, oh, this is crazy stuff, and why even respond to it, because nobody's going to believe it. But you'd be surprised how many people actually do believe it. So I think my advice would be to, sort of to address misinformation really quickly, right? I mean, there's this old saying that, you know, lies can go once around the world before the truth even gets its boots on. And basically, misinformation travels really, really quickly. And it's not just traveling, it also gains momentum. It's like the snowball, right? Which sort of gets bigger and bigger and bigger until it becomes almost impossible to stop. So I would say, I mean, obviously everybody has got their own judgment on this, but I would say act really quickly. I mean, if you see something that's obviously wrong that people believe, I think and maybe even act on, then I think it's really important to get in there quickly, would be my personal advice.
And then in terms of helping the truth get its boots on faster, I think one of the things that we've seen at ICFJ is that if you can use some of the same techniques to make information go viral that the bad guys are using, so to speak, using social media, GIFs, very snappy ways of puncturing these disinformation, can sometimes get that to spread more quickly than just writing a story. Use all the tools in your arsenal.
Absolutely.
Yeah. Another question here from India, the country where you're in. Could you please this is from Faizi, could you please give some tips for journalists looking at data in India, considering the fact that data is not robust, and what we end up with, as you said, is abstract numbers. What, how, where to look at numbers in India? What stories can we do apart from updates about the number of tests, infected, quarantined, etc.?
Yeah, I think this is a tough thing. So for those who are not, what the Indian government does is every afternoon it gives a tally of new cases, how many new cases, how many new infections, how many deaths, and also how many new tests have been conducted. Now, other than that, there's very little in terms of more figures coming out. So I think, and it's really hard. So once more, my advice would be, to the extent possible, to sort of go beyond the figures and try to see what's actually happening on the ground. So in India, for example, this huge issue, and not just in India, even the UK and other parts of the world, is a shortage of personal protective equipment, right? What impact is that having on healthcare workers, right? And once more, we've got figures saying that, so many, thousands of pairs of gloves have been ordered, and so, all of this is being produced, but then is it actually getting to people? What is the impact? What do our healthcare workers, doctors actually getting this stuff? We're short of ventilators, along with many other countries in the world. So there are a lot of stories of, 30,000, 40,000 new ventilators are being manufactured. I think we can go behind the figures to see how long does it actually take to make a ventilator if you've not, if you're in some other industry, because it's other industries with the same basic engineering knowledge who are making these. What goes into making a good ventilator? Are there different kinds of ventilators, and how long? In India, of course, is the country under lockdown, so your entire supply chain is disrupted, right? So what is actually happening on the ground? So I think figures are obviously just the sort of tip of the iceberg, or I don't know, to use some other worn-out metaphor, but basically they're an indication that there's something going on. I think the thing to do is really to go behind the figures and try and figure out what it is that's actually happening on the ground. So many tests are being conducted every day. How are samples actually being conducted? Who's taking them from place A to place B? How long does this process actually take, right? Is there a lot of delays between, each sample is tested twice, once at a local place, at a testing center, and finally at the national testing for confirmation? How long does this whole process take? Are there enough reagents and probes to actually conduct these tests, and so on and so forth? So I think we can, in a sense, having a paucity of data is not necessarily a disadvantage. It makes life harder because it forces you actually to go and look for other kinds of perhaps more meaningful stories. While if you have thorough, comprehensive briefings every day, and you can probably live off that as a journalist, right? You add a few more other interviews and you've got your story for the day. This forces people to work harder, but I think you probably get better stories at the end of the day.
And we've talked a lot about the medical health side of this pandemic, but the other side, of course, is the economic side.
Uh-huh.
Unprecedented. None of us will have ever lived, and probably, let's hope, we'll never live through something like this again in terms of the economic impacts. Any suggestions for journalists covering that side of the pandemic?
Oh, I know. I wish I knew. This is going to keep business and economic journalists really busy, I think, for a long time, because, one thing we can see is that globalization, the way it is, has to change in some fundamental way, because the weaknesses have become so apparent now, right? In terms of the disruption of global supply chains. Most production of most things is centralized in China now. So if anything happens in China, you're finished, right? And if you have a rapidly changing, moving virus, which governments respond to by shutting off transportation links, that has a knock-on effect on, it may help the growth, numbers it may help to flatten numbers, but it has this huge knock-on effect in terms of your global supply chain. So I think there's, many, many books, no doubt, are going to be written on this the new globalization that I think will emerge from this. So there are lots of stories. The one from our colleague who asked about investigating, contracts and so on, during this, is there sort of are there underhand payments going on? So that's at one basic level, but there are bigger stories as well. Where do the world's drugs and medicines come from, right? They come from India and China. The bulk of medicine, whether it's in the United States or whether, in other parts of the world, a lot of it comes from India and China, right? Why? Because these are the cheapest places to produce standard drugs. But obviously, anything like this will disrupt the supply chains as well. So how do we respond to these, and so on and so forth?
Would you like to see news media organizations change to be ready for the next time this happens? We probably didn't learn enough from SARS because it didn't affect the globe as much as this one is.
I know.
But we should be ready for another one. What should news media organizations be doing to get ready?
Yeah, I don't know how it is in North America, but in most parts of the world, health is seen as this slightly sort of soft thing. I mean, it's not like covering the White House or doing politics or doing business or, sort of, we see, being a war correspondent, these sort of, much more sort of serious macho things to cover. But I hope everybody realizes after this that, a microbe can devastate the world. And health is really the health of individuals, the health of collective groups of people, either societies, nations, the world, is fundamental to everything else that we do, right? Everything, the way the world works, is based on the fundamental premise of people being healthy, right? From our global supply chain onwards. Or sort of having, not everybody being healthy, but on the whole, the majority of people being in a constant state of reasonably good health so they can go work, and so on and so forth. Offices function, factories function, people can buy goods, and so on and so forth. So I think there's going to be a lot more emphasis on keeping the world healthy, not just from infectious diseases, but from things like cancers, all the diseases, so-called diseases of prosperity, as they are described. And hopefully, newsrooms will see that this is something they should be investing in. And I hope journalists as well, journalist organizations such as yourself, will also start sort of lobbying, saying, hey, folks, this is one thing that we have really learned from this. We need more people who, you need to invest more on trained health journalists, so that you don't have the next time this comes around, people don't have to start from the beginning again, right? And you do have trained manpower for this.
The sad thing is that the economic crisis is affecting news organizations as well.
That's true.
Many of them already are struggling to find a way to survive without revenue coming in. And that means cutting staffs.
I know. Mm.
Great. Well, I think we're about ready to wrap up. I want to thank you, Professor Abraham, for a really, really wonderful and very useful discussion. As I said, we'll be publishing a wrap-up of this discussion on our websites, and we will also broadcast or make available the entire video. I want to remind you also about webinars that we have coming up this week in English and Spanish. One of them is very relevant to one of the questions we got just a little while ago. Tomorrow, Tuesday at 8:30 a.m. Eastern Daylight Time, we'll talk about how journalists and doctors in Asia are collaborating to fight medical misinformation and share tools and tips with journalist Syed Nazakat and Dr. Ahmad Firdaus, both of the Health Analytics Asia organization. So very much getting at that data in India question, but also beyond India. On Thursday at 10:30 a.m. Eastern Daylight Time, we'll delve more deeply into another topic that we discussed, threats to press freedom around the world during this pandemic. And my colleague Julie Passetti will be moderating a panel with David Kay, who is the UN Special Rapporteur for Freedom of Opinion and Expression, and Courtney Ratch, the Advocacy Director of the Committee to Protect Journalists, both very high-level guests there, so we look forward to that. And then on Friday at 9 a.m. Eastern Daylight Time, we'll feature a webinar in Spanish titled, for those who understand Spanish, Cómo informar sobre la evolución de la evidencia científica de COVID-19. So how can we better inform people about how scientific evidence on the COVID-19 is evolving. So we encourage you to join us for those webinars, to visit the forum and exchange information with your colleagues around the world. One of the things that Professor Abraham talked about that we think is really important is to collaborate with journalists across borders. And that's one of the main reasons we set up this forum, to help journalists do that. So do visit the forum and talk to your colleagues about how you can join forces to better cover this issue. Again, I want to thank you, Professor Abraham, for being with us, and I wish you all the best in India. I know it's a very scary situation there, as it is in much of the world. So please stay healthy.
Thank you. And thank you for all the work that you're doing. I mean, I think this is amazing, and you know, the profession needs support like this, really.
Great. Well, thanks again, and we'll see you all later at the next webinar.